Hello, this is Dr. Abdulbaki, a pathology resident, and today in this session I will talk about the residency interview preparation for pathology. So first, congratulations, you got an interview, and this is the right time to, and even I think before that, start preparing for the interview. And over this session, I will go over the basics, the structure of the interview, and what kind of question that the faculty or the residents like to ask you, and at the same time, some strategies to answer on that, and what kind of questions that probably you need to ask them. First thing, it's about the interview schedule. Probably a couple of days before your interview, you'll get some information about the faculty members and the resident that you'll interview with and your structure. Absolutely, the interview will be different between the programs. The basics stuff are same. Most of the programs, they start with kind of orientation or introduction about the program. It's around like 15 to 30 minutes. Could be from the coordinator or like a program director, and it could be like kind of video lecture or kind of small orientation. And most of the time will be with the other applicants. Then you will move to the faculty interviews, and the average time for each interview is around like 20 minutes. You will interview with like 2 to 4 people, sometimes more like kind of five, including the program director or the associate program director, and it's like kind of one-to-one interview. For the resident interview, it's like more kind of informal uh, interview. Absolutely, you can ask them not just about the program, about their life in the residency in the city, and so on. Um, you'll have kind of breaks between the session, and the total time for the interview is kind of around 3 to 4 hours. Some program can offer kind of Q&A session at the end of the interview, and it's a great time to ask any your last question if you have any. So, what is the difference between the pathology and other specialties? Uh, Most of the question in the interview, probably it's related to two things. First, it's about your experience, about the pathology, and why did you choose to be a pathologist, and also some questions related to your personality, because in pathology they care a lot about the personality of the resident because they will work directly with you. Um, Usually, you will have less ethical and patient care questions comparing to, like, let's say, internal. It's like, in general, it's like more chatting. It's just like to know you better and to see if it's easy to work with you or not. First, a question that what kind of question the faculty will ask you, and I will go over the most common questions one by one. Most common one, and probably the first question they will ask. Okay, hey, good morning. Tell me about yourself. And what is my strategy to answer on that? And I understand it could be different from the people, but usually the time for answering it's around 1 to 2 minutes because you need to give them some time to reply on your answer. I like also to mention the present, what exactly I'm doing now. Let's say, okay, I'm a medical student or I'm research fellow or like I could be a resident from another country. Um, if I have any past experience I want to mention, I could do that. Future, if I have any goal in the future, could be in pathology or in general. What I like also to mention that things I need or I like people to ask me about. If you have any hobby, if you have any cat or dog. If you have any volunteering experience that you like people to ask you about, it's the time to put it there. Uh, just in your answer, try to be confident, um, try to speak in a clear way, and smile to give them like this kind of positive energy. Uh, Second most question is about why did you choose pathology? And I want to mention something here. Try don't to repeat the personal statement itself because they already read that, but try to give them your story. Try to be personal in your answer that don't mention just the general stuff. You could also mention a moment if you have any, uh, like one experience, case, or mentor that made you make the decision to go into pathology. Try to show them that you are also passionate about this specialty and focus on your answer. Don't go over another stuff. Also, what kind of stuff usually they like to, let's say, to ask you? It's not about testing you, it's about that they like, maybe they want to know more about one of your experience or research project. I highly recommend here before any interview to read more about your CV. Every word that you put there, you should be aware about. If you have any research project, at least you should know about the your rules in this project. What kind of about it? Let's say important results from this research project. Or also, you need to know more about your experience. Um, let's go over stuff that related to the program itself. Um I think most of the program they like to ask this question to see if you are really tied to the this program or not. So what made you interested in our program? I believe here you need to do your homework. You need to know specific features of this program, uh, like read more about faculty, what kind of fellowship opportunity they offer, and if they have any research or no. Also, you need to know more about their schedule. And location, the city, and where exactly the hospital. In the answering this question, I would like to mention 2 to 3 stuff that truly stand out to you in this program, not like just a general stuff. Also, it's good to align with your goals. Let's say if you are interested in GI, and this program can offer like a good GI training, so it's good to connect that with your answer. Also, if you know any person from the program, let's say mentor, resident, faculty, whatever, you can ask them more about the program, and you could also mention that in your answer that, okay, I asked this person, he's this from the program, and um, he give me like a good idea about the culture between the resident, or give me a good information about the program. And as I said, it's good also to be like to mention multiple things. Um, Another kind of question is like, okay, what are your career goals? They could ask you about your fellowship, or after you finishing, are you going to want to do like academic, private? Are you interested in AB more than CB? I will say something here. It's you don't need to have an answer. It's fine. You are going to the residency to learn more about that. But if you have an answer from your previous experience, uh, it's good to mention that, but at the same time, stay open to another choices. But try always to add a reason Most of their questions, it's not about yes or no. It's about to know you better. So with any question, try to talk more about it. Um, After finishing like with kind of formal questions, I feel especially in pathology, they like to ask you about like your life, what exactly you are doing outside medicine, if you have any hobby, let's say about movies, book, food, or whatever. I will say in this kind of questions, uh, just to try to be positive with your answer, show them your real personality and what kind of person you are, and I believe that's it. Uh, And after their questions, I believe most of the faculty will give you a lot of time to ask a question for them. And I believe here some like kind of strategy and tips you need to be aware about. When you get the list of the faculty that you will interview with, it's good to do some research about their background, what kind of work they are doing, if they are interested in research and education. So you can ask them a specific question. I will believe also try to avoid asking about things that they already uh, talk about it very well in their website or in the introduction, unless you need to ask about more information about that, and try always to show them that okay, I read that. Let's say okay, I read that in your website, but I want to ask about more information about this idea. So you can show to them that okay, you did some research and you are really interested in the program. Always good to connect your questions with the program strength. If you are interested in research and the program have a good research opportunities, it's good to ask about these opportunities and or what kind of stuff that they can offer to the resident. And as I said before, you will have a good time. Try to always have extra questions in your pocket to ask for the faculty. It just like kind of example. Eventually, you can ask whatever you want in professional way, but some kind of examples about questions like outcomes of the program. Let's say about the resident, where they usually go after residency, if they go to academic, private, or what kind of fellowship. You can ask about the feedback, if they have any way to deliver that for the resident, if they have any also like session, like let's say a non-slide session, if the program absolutely they have or they have kind of research, you can go over details on that, if they can offer any specific time to do research, and if the program can support the resident go to the big conference like USCAP or like also you can ask about the educational stuff. Let's say it's good to ask about tumor board if the resident covers or not. You can ask if there's like kind of balance between AB or CB over the program, and even kind of questions about the mentorship and about the career support after the residency. And as I said before, try just always to connect to your question to the specific program with the specific faculty. Um, After we are done with the faculty interviews, let's go to the resident interview, which is I like it. It's just a friendly, it's like just chatting interview. You can ask them whatever you want, not about the program. Ask them about the lifestyle there, the support, the culture. Um, I believe this is your chance to see if the resident actually enjoy working there, like kind of every day. Um, some questions you can ask. Uh, let's say about the work, about the call schedule. It's an important thing to know more about it. If the program offer also a good time, or let's say a balance between the service and the education, uh, kind of the supervision, and as I said, the feedback from the faculty. Also about the culture in general, if they go usually out together, I mean the resident, if they do anything together for fun. Um, and kind of questions I like to ask the residents, it's about the city if you don't have already information about it, kind of housing, how much you will pay for the rent, about traffic, about also the food. Um, Eventually, the residency, it's kind of 4 years if you are going to combine your program ABCB. So it's like kind of a life. So you need to know a lot, not about just the program and the academic things. You need to know more about the city, especially if you have a family. Also, you can ask more about the school and the college and this stuff. Um, I will say good luck for everybody, and I hope in the future we'll see everybody in the applying for pathology in their training. I really enjoy it. Thank you so much for attending this kind of session, and good luck again.